We have discussed a brief overview of multiple myeloma and causes, but what is the impact? Let us look at how a clinician would confirm a diagnosis of multiple myeloma. Commonly, patients will visit their primary care physician for either routine care or for a specific complaint. Often, monoclonal gammopathies are suspected due to abnormal test results. These patients are then referred to a specialist for confirmation testing. Some of the symptoms for multiple myeloma include unexplained anemia, which can cause fatigue and breathlessness, high calcium value, bone pain, unexplained kidney failure, peripheral neuropathy of unknown cause, and cardiomyopathy. To diagnose patients with multiple myeloma, the patient must have 10% or more plasma cells in bone marrow and one of the so-called CRAB criteria. CRAB stands for calcium elevation, renal disease, anemia, and bone lesions. In 2014, additional diagnostic requirements referred to as SLIM were added. SLIM stands for greater than 60% clonal bone marrow plasma cells, serum-free light chains of ratios of greater than 100, and MRI studies with greater than one focal lesion. Many of the symptoms associated with multiple myeloma are nonspecific, and this leads to delays in diagnosis. Statistics show that 22% of patients diagnosed with multiple myeloma need 6 or more medical treatments before referred to an oncologist. There are other tests that need to be run with serum protein electrophoresis and serum-free light chain to confirm monoclonal proteins. But for the purpose of our conversation today, we're going to focus on serum-free light chain ratio. This image is the International Myeloma Working Group clinical model of disease progression for multiple myeloma. This cancer arises from an asymptomatic precursor disease known as monoclonal gammopathy of undetermined significance, or MGUS. The characteristics of this state are listed on the model shown here. MGUS carries a risk of progression to symptomatic multiple myeloma of about 1% per year. As monoclonal protein concentration increases beyond the threshold of 3 grams per deciliter or greater than 500 milligrams per 24-hour urine, the disease progresses to smoldering multiple myeloma. Another asymptomatic disease state prognostically distinct from MGUS based on the risk progression of about 10% per year for the first 5 years, 3% for the next 5 years, and 1% per thereafter. Active multiple myeloma is diagnosed when the patient develops more than one myeloma-defining event and bone marrow plasma cells are higher than 10%. In addition, a clinician will see a patient's serum-free light chain ratio reach greater than 20. This is another indication of a progression to smoldering multiple myeloma. As monitoring continues and the patient worsens from disease, the serum-free light chain ratio will increase to greater than 100. Which indicates this patient has now entered the active multiple myeloma stage and treatment should be implemented. There is currently no cure for this cancer. As patients progressively acquire resistance to therapy, they progress through several types of treatments. Having no cure for multiple myeloma means second-line treatment is often required, and continual monitoring is needed to detect when the disease returns. When the patient goes into stringent complete response, the free light chain ratio will return to normal, indicating current treatment is effective. As the patient relapses, we observe an increase in the free light chain concentration, at which point new or additional treatment is needed once a threshold has been reached. As we can see through this progression model, the importance of the patient's serum-free light chain ratio is crucial to diagnosing the disease and important to use as a monitoring tool throughout its progression. Serum-free light chain ratios allow a clinician to evaluate when a patient has progressed from MGUS to smoldering to active multiple myeloma, giving them insight into whether the patient reached remission. There has been significant improvement to a patient's prognosis through treatments now available. In addition, being able to continuously monitor a patient for partial to complete response and potential relapse has also helped improve survival.